Hi everyone, I'm Chloe with In Lung Cancer Now at the IU Simon Comprehensive Cancer Center. Welcome to Clinical Chats, where we take a closer look at real conversations between patients and physicians and the communication choices that shape them. Because the right treatment decision isn't the same for every patient, it's the one that fits their life, values, and goals. In this episode, Fred, who was diagnosed with advanced stage cancer approximately 5 to 6 months ago, has recently undergone a scan indicating disease progression. This news is particularly difficult for him to process as he's been the primary caregiver for his wife, whose own health has been declining. In their discussion, Dr. Hannah and Fred focus on Fred's physical well-being and current symptoms, revisit his personal goals, and consider his overall outlook.
These studies do require a lot of you, and I think it's important for you to know if you were to go this route, not only would there be uncertainty as to whether this drug would help you at all, and understanding we think we have a good idea of what the side effects are, but you really don't know that for sure until you do extensive testing. But this is going to require a lot of you. It's going to require you to be here a lot.
Be here.
Yeah.
I have a lesson I learned from my mother. She had multiple myeloma, and she was diagnosed with, they told her she'd be fortunate to get a year, and she got 10 years. So I would weigh that in the equation of this. If I could help someone, no matter how much I'd love to help, it might be a bad decision for my family situation.
What I'll
A lot to
do,
absorb.
it is a tremendous amount to absorb. I will make sure that I get you some more information about all of the options we talked about. And we'll get you home, you talk to your family. Maybe you and I just talk again next week after we've gone over it. And I'm going to support your decision. I don't think there's a right or a wrong answer. I think people will choose different options that make the most sense for them.
In reality, I'm not going to get better. Really. I might get better for a bit, but true.
I would agree that this isn't going to make this go away. I think if you are looking for something that gives you hope for not only getting a response, but potentially a durable response, I think the research drug might have potential for that. We don't know that yet. But from what we've seen in the laboratory, sometimes this drug works really well and it works very different. Now, the standard therapies that we have, I can feel more confident are going to help you. But because we know a lot about them, we also know what their limitations are. And so most likely it'll be a kind of a shorter duration.
The right choice is personal. Patients shouldn't feel like they're trying to guess the right answer on a quiz. It's the physician's job to make it clear that the best choice is the one that fits the patient's goals, values, and daily life. That starts with clearly explaining the risks and benefits of all available options, including standard treatments, supportive care, and clinical trials, so that patients can make informed decisions. Open, honest conversations help patients feel comfortable choosing what truly works for them. Dr. Hannah models this perfectly by always bringing the discussion back to what matters most to Fred and what will genuinely serve him best.
All right, Mr. Smith, a lot to think about. I'm going to have Julie come in. She's going to give you information on the things that we talked about, the standard therapies, the clinical trial, and if you decide you don't want to do any of this. And
I haven't known you very long, but you've always been straight up with me, so I really appreciate that. If I can find an ace in the hole, I'll look for it, but
I know you'll talk it over with your wife and your family, and you think about it and pray on it, and then why don't you and I just touch base in about a week? And certainly, if you want to see me or talk to me sooner than that, you just let Julie know, and you know how to get a hold of her too.
a week will work. That'll give me time to get through it all.
Okay.
Yeah.
Okay, Brent.
Okay.
So good to see you.
You too. Thank you.
Thanks for watching Clinical Chats. Conversations like these help ensure that patients understand all of their options, including clinical trials, so they can make decisions that truly fit their lives. These conversations may feel challenging or uncomfortable, but are nonetheless important to have. After all, progress in cancer care doesn't just happen in the lab. It often starts with a good conversation. Today, Fred helped us explore what these conversations can look like. I'll leave you with him to share a little more about his experience.
I was diagnosed in January of 2013, about there. My diagnosis took a lot of twists and turns to lead me here, but I had to work. I'd come down and do radiation or chemo and then go to work and go home just to keep my brain going. So we got through that treatment and everything was good. And then in 2016, I started having 2019. A little before that, I was having severe shoulder pain up here. Finally, about 2 scans later, a little tumor popped up in that head. I don't know if it totally ate the nerve, but it pinched it off. It was, I think, just totally gone. Then I was fortunate. I was a genetic match for Keytruda, which in 2013 wasn't even an option. Again, all those twists and turns, both my cancers are discovered because of other problems. My prognosis was maybe you got 6 months, maybe you got a year. That was in 2013, and that'll really wake you up. All's good. I'm fortunate, and I know it, and I still think had I not went the path through Dr. Hanna and everybody, I wouldn't be here. I honestly believe that.